The Effects of Legalizing Marijuana by Jeanette, Simon, Elena, Haley, and Cody. Our presentation is broken up into 6 subtopics, which are history and usage, potential harms, medical applications, healthcare expenditure, increased regulation, and lastly, the effect on insurance.
For most of its history, the United States had few regulations when it came to marijuana, although some states considered it a poison for labeling purposes. Then in 1913, California amended its 1907 Poison and Pharmacy Act, adding marijuana to the list of narcotic drugs that were banned for use without a prescription. Over the next couple of decades, several states would follow suit, but the push for federal regulation didn't begin until 1930, when Harry J. Anslinger was appointed as the first commissioner of the Federal Bureau of Narcotics. After several years of campaigning, he convinced Congress to pass the 1937 Marijuana Tax Act, which levied massive taxes on the sale of marijuana, effectively outlawing it. Most relevantly for us today, though, Congress later passed the 1971 Controlled Substances Act, classifying marijuana as a Schedule I drug with no medical uses and extremely high potential for harm and abuse. The possession and use of marijuana remains a felony under federal law to this day, although some states have started passing laws decriminalizing it to some degree or another. But what is marijuana? Well, it's a psychoactive drug derived from any of 3 species of cannabis plants. It gets its effects from a compound called delta-9 tetrahydrocannabinol, or THC, which binds to endocannabinoid receptors in the brain, triggering the release of dopamine and norepinephrine, which causes a high. It also contains cannabidiol, or CBD, which makes up to 40% of the plant's extracts. However, CBD has no psychoactive effects, and research suggests that it can counteract the effects of THC to some degree. Like many drugs, marijuana can have side effects. The most serious of these, of course, is dependence, where the body produces less of its own chemicals and reduces the sensitivity of its receptors, causing withdrawal when marijuana use stops. Smoking marijuana also causes lung damage and respiratory problems, since the smoke contains several carcinogenic compounds and deposits lots of tar in the lungs. In addition, the endocannabinoid system is involved in a lot of biological processes, so marijuana can also have side effects like drowsiness, impaired memory, and impaired motor coordination. But marijuana is still safer than most other drugs. Studies suggest that smoking tobacco causes more lung damage, and there's no solid evidence linking marijuana to any cancers, unlike both tobacco and alcohol. Plus, studies suggest that alcohol impairs drivers more than marijuana does. Research also suggests that marijuana is less addictive than pretty much every other drug, and there are no credible reports of deaths caused solely by marijuana use to this day.
In recent times, marijuana has been used to treat many diseases and disorders. In the graph to the left, these were the most common disorders who applied for medical marijuana. Most notably were the cancer patients. It was found that in cancer patients, they found the therapeutic effects of marijuana to soothe their nausea, appetite, and pain that they experienced from chemotherapy. In people suffering depression, they found that marijuana was able to stabilize their moods, decrease their anxiety, and decrease their depression. Recently, many doctors are now seeing the favorability towards marijuana over the conventional prescription drugs.
Thanks to its medical applications, access to marijuana leads to a significant decrease in several drug prescriptions. Most notably, prescriptions for antidepressants, anti-anxiety meds, and seizure and nausea medications decreased by several hundred doses each, according to one study. Most importantly, though, studies show a 6% reduction in opioid prescriptions associated with access to medical marijuana. This is important because many illegal drug users start by abusing prescription painkillers, as many as 80% of them in the case of heroin users. And studies show that access to marijuana is associated with a decrease in fatal opioid overdoses, from 8 to 25%, depending on the study. This is especially impactful, considering the opioid epidemic America has been facing as of late. This reduction in prescriptions also led to a massive $165 million decrease in Medicare Part D spending in 2013, with a further estimated $486 million reduction if all states would have legalized medical marijuana. And it's likely that other insurance companies would also see a reduction in spending as well. The thing is, the drop in Medicare and insurance spending is because insurers don't provide any coverage for medical marijuana, since it's still illegal at the federal level. This means that users are paying those costs entirely out of pocket. And while you can grow your own marijuana at home, almost every state requires you get a license for it, which can cost anywhere from $600,000 to $500,000, depending on the state. But if federal laws were to change, then it's possible that insurers might start to cover medical marijuana, which could mean a big reduction in out-of-pocket costs for users.
On the national level, over $7.6 billion were allocated to enforcing marijuana laws. The highest costs came from the prosecuting, sentencing, and incarcerating of these individuals who are caught. And, with recent times, many don't believe that marijuana crimes are as serious as other crimes. Some costs that cannot be measured accurately deal with the user's cost. After getting arrested, one can have their license suspended, denial of employment opportunities, and removal of public housing. A big issue that comes in with this is the disproportionate arrest between white people and black people. Typically, there is an equal distribution among the races regarding marijuana usage, but in states like Iowa, black people are 8 times more likely to be arrested for possession than a white person.
The recent trend shows that people are switching from alcohol to marijuana. Specifically, binge drinking rates are significantly lower in states where adults can legally buy recreational marijuana. The increase in marijuana users brings up the importance of states having the ability to regulate products in order to protect consumers and decrease the prevalence of laced marijuana. Lacing is a very common occurrence, particularly in drugs like marijuana and cocaine, which are often laced in order to bulk or increase the original product. There are various different drugs that marijuana can be laced with, such as heroin, cocaine, LSD, and many other harmful substances. Marijuana lacing is more likely to occur in cases where people are selling a drug illicitly and are trying to enhance its psychoactive effects. The legalization of cannabis would reduce the potential for violent drug interactions. Consumers would no longer be risking their safety to purchase illegal THC on the streets. The legalization would encourage consumers to purchase the product at a dispensary where the environment is safe and the marijuana is regulated. CBD is the second most prevalent active ingredient in marijuana. While CBD is an essential component of medical marijuana, it stems directly from the hemp plant but does not cause a high on its own. Currently, all 50 states have different laws legalizing CBD with varying degrees of restriction. The regulation of CBD sales is beneficial because there is evidence to conclude health benefits such as alleviating insomnia, anxiety, chronic pain, and addiction to other substances. So, in turn, the regulation of CBD may push consumers to this product instead of other legal harmful substances. Overall, the ability for states to regulate cannabis will allow for easier accessibility, encourage consumers to purchase a safer product, and as a result, decrease the prevalence of laced marijuana.
Now we are going to move into the insurance changes that we would see if marijuana became legalized. We're first going to look at car insurance. A study that I focused on found that car insurance premiums would drop by around $5 per year. This effect actually became stronger the closer one was to a dispensary. The most likely reason that this happened was that it steered people away from using alcohol. Alcohol is a much more social drug where there are many opportunities to go and drive to a place to get under the influence. Marijuana seems to be consumed more in-home, resulting in fewer car incidents under the influence. Again, this is not proven, just what the data suggests. Next, we're going to turn to life insurance. Now, this isn't an easy thing to decipher because marijuana isn't really like any other legalized drug. One could say that it's a lot like tobacco, but it is different because the effect that marijuana gives off. This most likely would lead to a guess and check system while marijuana was first being implemented. Finally, we're going to look at property insurance. Marijuana is a crop and would most likely be treated like other crops. This means it would be protected from fire, lightning, and vandalism, just to name a few. Growing marijuana efficiently also requires a lot of equipment, so that would also have to be written into the plan. From what we've seen in recent court cases, rulings are usually in favor of the marijuana owner, even in places where it's not fully legalized.
One cannot discuss the legalization of marijuana without considering the effects tax laws and revenue will have on both the people and the industry. Currently, only the recreational sector of marijuana is what is being taxed. This keeps medical marijuana at a lower cost while capitalizing on everyday recreational users. Currently, marijuana tax revenue can account for up to 1% of a state's tax revenue in states like Colorado and Washington, and it is still significant in the other states where marijuana is legal. With this amount of revenue, The states can leverage it to not only refine the taxation and government aspect of legalizing marijuana, but it can also be used to educate people on the dangers of drugs while also being used to pay city wages, better schooling systems, and so much more. Taxing would also help to get the drug out of the hands of minors. And in considering the legalization at a federal level, the tax revenue that they would collect could do a lot of good as well. Legalizing at a federal level would also extremely benefit those involved in the industry. Currently, businesses aren't treated the same as other businesses because it is not federally legalized. They lack banking necessities, federal tax deductions, and also interest trading. This would change with federal legalization. In legalizing marijuana, prices in the long run would actually decrease as well. With better business opportunities and competitive prices, the consumer would benefit as well as the government and our country.